went from the bonnet, found face down on the floor.
2, 3.
Paediatric trauma
It's
call.
a stabbing, Cordred.
25 feet from a ladder onto his back.
He's really unwell, and I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
Kings A&E, how may I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life, and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
About 3.5 hours. Oh, bloody hell.
I'm going to take you over to this bed now.
Freezing.
Fine. Do you smoke at all? Do you drink any alcohol?
Yes, I do.
What do you drink?
I like a glass of wine with my dinner.
That's okay, a glass of wine a day. It's supposed to keep the doctor away, apparently.
I think I'm just about to faint.
Really? You need more coffee. Or less coffee. No, one or the other. It's either more coffee or less coffee, or more alcohol or less alcohol. It's one or the other. I think the reason that we do so much self-medicating is probably with the pressures of life. I think people just need something else. They need a crutch. Unfortunately, about 60–70% of what I see every day is as a result of alcohol and smoking. They're probably the commonest ways that we would see people self-medicate.
Right, take care then, Pat.
Yeah, I will.
Thanks a lot, mate.
Wasted your time, you
I have not wasted my time.
Right.
No, you're having too many falls. You was out conscious.
We could go round the doctors anyway.
No, you will not till next week.
Here, sit down. Get a chair.
71-year-old Pat has a history of brain hemorrhages. Tonight, she was found unconscious at home by her husband, Bill. It's her second collapse in the past week.
Georgie, can you send that round? Yeah, get her booked in.
You're all right.
I'm fine, thanks. Hi, Pat. My name is George. I'm one of the...
New, another one.
I'm one of the staff nurse here. I just come to check your blood pressure and all.
The blood pressure's all right.
Do you?
Let them check it.
Have you, is this from today, this cut in your...
Yeah, I fell over last week.
Last week? Oh.
Otherwise, I'm fit as a fiddle.
Okay. I just wanted to take your dressing gown off, if you don't mind.
Oh, you bleating wait. I need this dressing gown on. It's so cold in here.
All right, love.
Oh, it is cold.
Have you had any alcohol today?
Any what?
Alcohol.
Yeah, I've had me drinks and I always do.
Something nice?
Oh, gin and tonic. I love them. He likes his old whiskey, don't you, Bill? That's his nightcap.
All right. Good.
And me ticker, all right?
It's fine.
Yeah, see, I told you, didn't I?
You are the next one to be seen by doctors anyway.
Ain't he coming yet? Because I want to bleat and
Have
go
a little sleep
home.
for her. You wait.
What?
Don't be impatient. Behave yourself.
I ain't done nothing yet.
Just in case you do. Just in case you do. Don't get stroppy with the doctor and all.
Kings A&E, how may I help? Severe posterior head. In bleeding from what? Right ear. Yep. Yep. 7 chairs, 7 minutes.
Adult trauma call, 7 minutes.
Paramedics are bringing in a 63-year-old man. He was found lying in the street by a neighbour.
Boggy mess, head injury, query cause with right ear bleeding and vomiting.
Blood coming from the ears usually suggests that somebody's got a fracture of their skull.
Yeah, I know. I've left my black pen in the... Male, found in street, severe head injury.
It's one of the signs that somebody with a head injury has had a significant head injury.
It could be wrong. What is it? Delta. Oh. Yep, we're going into 2.
Why don't we keep him on the scoop, but let's have him flat.
Right, okay. 1, 2, 3, go. This Mick was found laying flat on his back on the pavement. He's got blood coming out of his right ear, pulse of 73. He's really, really combative. As you can see, we've had to take the mask and everything down. And...
No moving, darling.
Mick, I know you've had a drink. Can you tell me what day of the week it is? Keep your head still.
Thursday.
Sorry?
No, it's Friday, isn't it?
OK, and what month is it?
March.
And what year?
Treating patients who are inebriated is very difficult, but you have to assume for their safety that it is not the alcohol that's making them behave the way they are, that it's something else.
So 2012.
OK, and do you drink every day?
No, I don't.
No? Is it just a bit of a bender tonight?
No, because I'm Irish and it's Paddy's week.
Oh, it's Paddy's week, not just Paddy's day.
I love that. St. Paddy's week.
OK, now, have you got any pain anywhere?
So I just need to go and see my wife.
Your wife's coming. She'll be here in a minute.
Of course.
No, stay still.
Keep nice and still, don't move your head, because we don't know if you've injured your neck. We're going to have to scan his head.
They are the one group of patients that are very likely to catch you out, because when people are drunk, it all interferes with the decision-making process.
Keep still, Mick. We've got you.
Mick.
You need to talk to us, but just keep still.
You promised you were going to be a good boy.
Otherwise, we're going to have to put you to sleep.
That's all right, darling.
Mick will need a CT scan to determine the extent of his injuries, a procedure that requires the patient to remain completely still.
Right, let's go and get it done. You're just going to have to hold him. Hold his head.
What we worry about is that they may also have a neck injury or a spinal injury, and if you've got somebody who's thrashing around, they may actually cause themselves to have a further injury.
Yeah.
They could end up paralysed.
No, I think we're going to have to just put him to sleep. We've got our drugs.
Hello? Hello?
You hungry, fam? Pizza Hut. What, delivery to the hospital? What would you like? Medium meat feast, barbecue.
I'll just have a slice of his and a slice of yours.
I'm still in A&E. I think I broke my finger. Yeah.
Hey, please, can I get delivery, please? The postcode? Ooh, that's a great question. You might have to give me 1 second.
They trapped my finger in the door at the bank. Yeah, I mean, but look at your finger.
You want me to come for collection, dude? It's like 5 minutes up the road. You don't deliver to my house in Brixton. Like, please?
Right, OK, team. Are you happy to hold head from that side?
It's been 20 minutes since Mick was brought in with a head injury. Although he's been drinking, doctors are concerned that his confusion is a result of a brain hemorrhage. He's being sedated to prevent him from injuring his neck.
Right, mate. We've got your head because we're going to need to get you off to sleep. Your wife's here.
Let's get some proper tape.
Where?
There, look, here you go. Say hello. Don't try and lift your head. Come and just look over him so he doesn't believe me that you're here. Can you look over? Just look.
Well,
I'm here.
We're going to turn it off in a second anyway.
Oh, yeah.
So there's drugs already.
I'm here, don't worry.
Okay, thank you, darling.
What size tube do you want?
We've been married for 36 years this year. When we were younger, he was quite the Jack the Lad. He really was. He liked to play darts and snooker, and he was really a man's man.
Tish, you're here.
I'm here, don't worry.
We need to scan his head to work out how much of this is booze and how much of this is head injury. And you won't keep still for the scan.
I never bash my head.
So we just need to send him to sleep. Do you know if he's got any medical problems?
He's on antidepressants.
OK, he's never had a problem with anaesthetics before, though. OK, have you got his head there?
He's a good-looking guy. He had the big bell bottoms and the big platform shoes. He says he looked like Georgie Best.
Found it.
It won't take long. We'll just
Right, let's go and get it done. So when you're ready, I'll get the collar off.
We got married at Wandsworth Registry Office. And after the ceremony, we all walked down Wandsworth High Street, me in my wedding dress, to go to the Spotted Dog pub down Wandsworth Road. And as I walked across the traffic lights, all these drivers were honking their horns and waving at me.
Right, Mick, sweet dreams. Fantastic. OK. Should we put the collar back on? Because although he won't move, per se, we might move him.
He was kind. And he was generous. And he'd give you anything. If he could, he would give you anything.
Majors.
I thought you was dead.
You are?
I thought you was fucking dead. You look on a deck we had. You look, watch me. Hello. You was like that.
What?
On the floor.
Yeah, all right.
And I was trying to get you out, and there's no response. That's why I phoned the ambulance. You had too many bloody falls to my liking. You better pack that drinking up.
You what?
Better pack that drinking up, I'm afraid. It's affecting you. 17 years old when I met Pat. Pat was a bit of a tearaway. I have to say, bit of a tomboy.
Is it Mrs. Cathersides?
Yeah.
Hello there. My name's
Go out,
James.
Doctor.
It's up to your... Is this your
go
husband?
No.
No?
He wants to examine you.
Yeah, well, you see whatever he's going to say.
I'm not going to do anything just yet, don't worry.
All right.
Take a seat, sir.
Leave now. See, we've been married 54 years.
I'll stand out here for a little while. She was a good dancer as it goes when she was a bit younger. Mine, I've got two left feet, I have. Pat loved Elvis Presley so much. When he died, she went in mourning for over a week.
Do you mind if I call you Patricia?
Pat.
Pat. My name's James. I'm one of the doctors. Have we taken any blood yet?
No.
Do you mind if I take some blood now? Would that be all right? Yeah? I'll just get my gear. I'll be back in 1 second, OK? Leila, I'm just going to take some blood and have a chat with her. I won't examine her for about 10 or 15 minutes. So you're welcome to wait in there.
Oh, you miss me?
Yeah.
Was she pretty?
Yeah, she was pretty. She had a few boys chasing her, but she chose me. Don't know why.
So, just a sharp scratch.
Ow.
Sorry. What's brought you into hospital?
All I know is me legs keep giving out.
OK, again...
Bill will tell you.
So, you didn't feel lightheaded at all?
No, I don't suffer with anything like that. Bill!
What?
Bill's just here,
I'm
don't
up
worry.
here.
OK. Do you remember hitting the floor?
No.
Pat, you didn't lose consciousness, and you remember being on the floor?
No, she don't.
I'll come and chat to you in a minute, is that right?
I've had a couple of gin and tonics.
OK. Do you have any other medical problems?
No.
10 years ago, she had a massive brain hemorrhage. That's what I was worried about, you know, when she went over today.
OK, I'm going to send these off, and then I'll come back and have a chat with you, OK? Good stuff.
Bill?
Yeah?
He can send me blood test off when he's coming back.
You all right?
He said, do you like drop of gin? I said, yeah.
Yeah, you're not getting no more. I'm going to throw it all away.
You keep starting, I'm telling you.
I ain't starting, I'm just letting you know.
"63-year-old Mick was brought in with a head wound after being found alone in the street. Having sedated him to prevent further injuries, doctors can now scan his neck and brain.
Slightly up as we go. Ready, brace, slide. OK. Can we have our vent?
When I first saw him, he was drunk. My best friend worked at the same company as him, and she told me to go to the Christmas party. So I went, and I met him there. But then when he asked me out, he messed it up. He just said, "Oh, do you want to, can I ask you, will you?" He said, "No, start again, Mick." And then he started again, and he said, "Would you like to go out with me?" So I said, yes. He's just a social person. He just hasn't got that thing in his head that's to say stop. You know, he doesn't know when to stop, basically.
He's got a brain injury. If the brain injury continues, then he's in the right place. Because he's at the risk of, you know, continued edema at this moment.
He's always suffered with depression. He just gets a big black hole in front of him and he can't see any point in living. It's very difficult because there's nothing I can do apart from be here.
Right, troops. He's got a right shallow subdural, contusions both temporal and inferior frontal lobes. Fracture right temporal.
Mick's CT scan has revealed internal hemorrhaging to his brain. He will be admitted for an operation to reduce the risk of permanent brain damage.
Right, I'm just going to talk to his wife.
Yeah, sure.
Hello. As you know, he was found collapsed. We don't really know how, but he's got wound to his scalp, and he does a couple of bruises around his brain. He's probably going to wake up still a bit drunk. Yes. So the safest thing to do in this case is to wake them up slowly on critical care. Could you imagine if we took the tube out now and he goes to do Lally in half an hour's time? Yes. We won't know whether that's because he's just woken up and he's a bit drunk and disorientated and a bit leery, or whether it's because the bruise in his brain is getting bigger. So this is the safest way to do it.
OK.
Does that make sense? OK. Right, we'll come and find you. It's Pat, isn't it?
It is Pat, yes. Thank you very much. We're going to medical, aren't we? Who's he coming in under?
Did you and Mick have any kids together?
I decided we wouldn't have any kids while we were living in a flat. And we never moved out, so we never had kids. He would have been a good father. He would have been really soppy. He wouldn't have ever said no. He would have been a good dad. He would.
We're going up now if you'd like to come with us. Sorry, John. Are you going to come, Kev?
So this is new to me. I had chest pains. So like when I inhale my chest cavity, it really hurts. And as it's progressed, I've got strong numbness in my hands, and I can feel it in my teeth and in my face.
This vending machine's evil.
Do you know what, yeah? No rolos in it, yeah? I forgot they existed at one point in life.
They're not really that nice, though.
They are, man. Rolos are bad.
Just to put my mind at ease, I watch too many TV shows and read too many books. It doesn't want to be like a stroke or none of that kind of crap.
You don't read enough books.
Okay.
You need to read some more books.
Okay.
Hello, Kings A&E. Yeah. Yeah. 5 minutes, lovely. Thank you, bye. Chest pain.
Red phone, 5 minutes, red phone, 5 minutes.
A 50-year-old man is being rushed to King's with a suspected heart attack.
Yeah, chest pain, yes please.
Mechanical engineer Graeme has been brought in with his brother and business partner, Tony, after complaining of chest pains at work.
Right, hiya.
Hello. This is Graeme. Graeme woke up at 6 o'clock this morning with a bit of tightness in his chest, varied in intensity throughout the day.
Has he had GTN?
He has.
Right, woke up at 6 o'clock, Des. With chest tightness, which has got worse throughout the day, radiating into his jaw, neck, and both shoulders and upper back.
I've never had a heart attack, but I know that people describe it in various different ways. Very often described as a belt around their chest or somebody actually sitting on their chest. Hey, Graeme, is it? Good. I'm Des, I'm one of the A&E consultants. What's been going on? Tell me.
It's hard to describe it. It just started coming on.
Yeah.
It feels like it feels like someone's standing on you.
Okay. Have you ever had this before today?
I have.
Yeah, and have you seen anyone about it?
No.
Okay, all right. A couple of gentle, deep breaths in and out for me. That's it. Good. Men are a silly breed when it comes to health. Men tend to ignore very obvious warning signs for a long time before doing anything about it. Have you noticed anything that's made this better or worse, or just does its own thing?
I'm a bit concerned it might be to do with stress, worrying about things.
It may well be stress-related, but I got to assume that this is coming from your heart until I know that it's not coming from your heart.
Okay.
If you have multiple episodes of heart attacks that is causing damage to the heart, the muscle of the heart, that damage is irreversible. Gentleman with chest pains since this morning, about 6 o'clock. Normally CG, waiting for his troponin. I'm not going anywhere, so I'll follow up on the result of his troponin and whether he comes in or he goes home.
Hello, Tarek, it's Ellen. I'm calling from A&E. It's not for me, but my boyfriend had a little accident. We're still just like waiting to be seen, and I don't really know what to do about like tomorrow. Obviously, I'm going to come in. Yeah, cool, will do. Okay, cool. Thank you. Bye. Bye.
I always got told when I was growing up, if I kept playing with it, it would fall off.
And every time you do a kinder.
50-year-old Graeme is suffering with chest pains. He's under observation to establish whether he's had a heart attack.
Heartbeat's gone down. Your heartbeat's going real down. It hasn't changed at all. So I don't know what I am. What do you know I am?
Yeah.
It might. Are you sticking your middle finger? Boy, does Graeme love gadgets. You know, technology, he loves it. You know, in the 80s, we were the boys that had the toys. Done the water skiing and the motorbikes and the Hells Angels rallies. We've done everything. And we had good times together.
89.
So you see the same as me, isn't it? I'm 99, look. I'm 99, so you're actually lower than me.
No, not you're 88, not the green bit.
So what's 99 bit then? And Friday night and Saturday nights, we were always out. Around all the trendy bars and into Bermondsey and all the funny haircuts and the dyed hair and We had it all, the clothes. It was the 80s.
Go on, bung it back on.
No, they're not going to put it back on. It's got to be deflated, isn't it? I don't know how you deflate it. You got to pop it. We shared a room, half each, literally half each. And it was the worst boys' room you could ever imagine. My mum would not go in there. She would not tidy it up. That's the boys' room, leave it. But when he moved out with Gina, I got everything and just threw it all down a scrap, all down a tip. Got rid of all of it. No, Babette. Hello, Claire. Gina, all right?
Graham's wife Gina and daughter Claire have arrived in resus.
I don't know.
I was instantly attracted to him. As I looked at him, I knew he was going to be my husband. I think I'd only sort of seen him 3 times and spent maybe the total of 2 weeks with him before I decided that I was going to come and live with him. And so we've been together 26 years now. Give me a kiss. I came from Jamaica to visit my nan. She picked me up and the car broke down. And she phoned Tony and Graeme and they came to pick us up. And that's how I met Graeme.
Ah, Des. How are we getting on?
So the tracing of your heart that we've done, the first one, looks completely fine. And it's the same as the one that the ambulance people did as well. That's completely fine as well. I'm still waiting for the rest of your blood tests and stuff to come back, and they will be really what will determine what happens from here on in. So we'll have a look at those blood tests and see, do you need to stay, or can we send you home and see how your heart behaves?
Much appreciated.
Yeah,
no fantastic.
Thank you.
Pat was brought into A&E after losing consciousness at home. Doctors are studying her blood test results to find out why she has collapsed.
Can I ask you about it quickly? Is that all right?
Yeah.
She was unconscious, no fitting. She was flat for somewhere between kind of 3 and 5 minutes, and when she came round, she was fast negative. She seems objectively a little bit kind of woozy and
Okay, is there any lateralising neurology?
Bill, bring me bottle in.
Yeah, tomorrow. Go to sleep for a while.
Patients with head injuries are tricky customers, and they're the people who we need to watch. It's not that they get worse, but they become different. And sometimes that's all there is to suggest that there is something serious going on inside their head.
Something else is going on.
Something else is going on. They see what the actual lab sodium is.
Just go in the bedroom, that's all you got to do.
You're in hospital.
OK, right. Pat, I'm going to have a look at the nerves in your face and then your arms and your legs, OK? Is that right? But I'm going to have to ask you to follow a series of commands for me. Is that OK? Can I ask you to follow my finger with your eyes? Ready? Very good. Any double vision? No? And what if we go this way, Pat?
10 years ago, she fell out the bleeding bed and she smashed her head against the wardrobe and she ended up with a massive brain hemorrhage. What we was worried about, how long she was in that coma for and she could have turned into a vegetable, like, you know, and I wouldn't like to have seen that. God, I don't think I would have been able to handle that. She lost use of her legs, her arms, her speech, and I panicked.
Keep your head still for me and just follow my finger upwards. Pat, can you follow my finger upwards? My finger, I need you to follow it with your eyes, OK? OK.
She keeps asking for a water bottle, it ain't here.
It's right outside of me bed. You don't have to look for that, Bill.
Is this
It's
normally
just at the side of me bed.
Is this normally how she acts after she's been drinking or not?
Well, I've never known her like this before.
Okay, I think we're going to have to do a scan of her head.
Yeah, I would. Yeah, I think so.
I think we're going to have to.
Yeah.
Okay?
Yeah.
All right, then. Right, I'm back in a second, okay?
You're all right, mate.
Pat's test results indicate that her confusion is a result of something other than alcohol. A CT scan will tell doctors whether she has suffered a brain injury.
Well, you always fear the worst, don't you? And when the doctor said, oh, don't look too clever, I thought, oh, here we go. Not again.
Oh, hi, is that radiology? Hi there. I'm calling to request a CT head on a patient. She's in Majors, Bay 12. Thanks very much indeed. Cheers, bye.
I just want Nutella. N-U-T-E-L-L-A.
Nutella.
In reception, 21-year-old Chris has been assessed by the triage nurse. He's waiting to see a doctor.
Question. Superman versus Hulk. Yeah, who will win?
Hulk.
Superman.
Hulk can't die. Hulk can't die. Hulk can't die.
What do you mean Hulk can't die?
I mean it exactly as it said. Can I not have a preference?
Superman is the best superhero.
But
I just don't like his uniform.
yeah,
Why France?
at least Iron Man has swag. Do you know what I mean? He has no swag.
Christopher Restrepo?
Right here.
I'm sure, fam.
You right? Yes, mate. Oh, thank you.
Hey, which one's Chris?
I am.
Oh, right, okay, sorry. There might not be enough room for all you guys. It's just a small cubicle, but we'll try and scram you all in.
Okay.
Grab a seat.
All right, thank you.
Hi. Right, Chris, what's been going on?
Basically, earlier today, I just felt pain in my chest, and then I had shortness of breath. And when I brushed my teeth, I had coughed quite severely and spat out blood.
After you brush your teeth?
Yeah, just in general, yeah.
You're just not sticking your brush down a bit far? I think that's what it sounded like.
Oh, no, definitely
it's
not that, no.
It just somehow, all of a sudden, you have a coughing fit, and at the end of that coughing fit, whatever comes up is pretty bloodstained, or has it never been bloodstained?
It's been bloodstained, sometimes it's been brown. I smoke a little bit as well, so it's been brown, I think maybe tar or what else.
How much do you smoke?
Ooh, 5 a day.
5 cigarettes a day?
Yeah.
Are they roll-ups?
Pardon me?
Are they roll-ups
Yeah,
or
roll-ups.
No, you're not. Let's put this top off and let's see where it goes. No worries. Okay, show me whereabouts this pain is. Okay. Yeah, what we're going to do is just going to whip you around for a quick chest X-ray. Okay. You're coughing bits and pieces up, and you've got some chest pain over here, which could be from an infection. So let's do that now. Slip your T-shirt back on.
Graeme is being closely monitored in resus. Dr. Des is studying his latest test results to establish the cause of his chest pains.
You got the pain back?
Starting.
Come me down, tell him.
No, it's nowhere near.
Try and take deep breaths and relax.
I'm not saying wrong with me, where it's just anxiety. I'm starting to get the hump of it because I can't decide what it is.
Listen, Graeme, you've had a warning. You're doing, what, 40, 50, 60 fags a day?
Graeme worries a lot. He definitely relied on the cigarettes, I think, for lots of things. He was probably out of control when it comes to cigarettes.
How do?
Yeah, I'm feeling all right.
Right.
Well,
your bits and pieces, for the most part, have checked out. But one of the tests that we've done is abnormal. And it's the one test that, for us, holds the most importance. To me, in many ways, it confirms that the pain that you've had is coming from your heart.
The first thing going through my mind was, is he going to die? I don't want to be a widow at 45, I just don't. And he's got to survive, he's got to make it through this.
But I think we still need to do a couple of other tests to see, is it? And if it is, how bad is it? And then what can we do about it?
It was very scary for me, very scary. I don't know what I'd do without him.
Graeme's test results indicate that he's suffered a minor heart attack. He will be admitted to King's cardiac unit for specialist treatment.
So he's going to be admitted tonight or today.
Cannot deny, but I do feel semi-written off now.
Semi-written off? Okay.
Does that make sense?
Yes, it does. You're not alone. Most men of middle age have a moment of, I suppose, coming to terms with your own mortality. There comes a point, I think, in every man's life when changes may need to be made. I think very often it's more the changes that you need to make to your own lifestyle that are the hardest that we find to do. Nobody likes being told what to do, even when it is your own body that's telling you that you need to do it.
Thank you for the care.
Yeah, you're not written off. No.
Semi, I did say semi.
No, not even semi. No, not even semi. Don't worry about that. We'll get some work out of you yet.
Yeah. Thank you.
Right.
Thanks for everything.
All right, not at all. You're welcome. I stopped smoking in 2004, and I decided today's the day, and it was. That was it.
Was it hard or easy?
It was easier than I thought it was going to be, but it wasn't easy.
Take it easy, eh? Take it easy. Seeing Graeme in that state, I think you realise you're not here forever. Take it easy.
Thanks
You'll
for
be fine.
everything,
Listen, you'll be fine. People do pass on, and it's sad. Your friends and acquaintances come and go. Family, it's always there, isn't it? All right. Where are you, at the pub? Here's me brother. I wouldn't pick another one.
Could I have a porter to Majors, please? Porter to Majors, thank you.
Tricia,
Yeah.
are you all right? Let's pop this on you, my sweet.
Pat is being sent for a CT scan of her brain.
Number 12, CT, mate, please.
Doctors are concerned that her increasing confusion and disorientation are the result of an internal head injury.
It'll be a bit cold, all right, in here? It'll be a little bit chilly for you. OK, on your call.
Yeah, on, slide ready.
On your call.
Ready.
Oh,
That's it.
it's OK. She's got
Rest
earrings
down.
in.
Okay.
Nice lady. Very nice couple.
What's the nicest thing about Pat?
She's my best mate. She's been a good mother to my children, like, you know, and been lovely. Don't get me wrong, it ain't been smooth like all the time. Pat lost a brother through drowning. I think Pat was about 16 at the time. Anyway, we've been out to have a drink. It was on a Christmas Eve. He's had a row with his girlfriend, and we had a canal where we used to live. He threw himself in the canal. I went in there after him, but I couldn't get him out. I don't think she's really got over that, really.
Will she talk to you about it?
Mostly, if it comes round about Christmas time, she might mention it. Or she's had one too many, like, you know, it upsets her, and she'll say, oh, my Billy, like, you know.
She's got a head injury, so I don't know if she had something happen before.
OK.
But that, or whether that's as
Yeah.
a result, she's
Right.
collapsed. So.
OK.
All done, well
All
done.
done, Patricia.
Hands down for me, that's it.
there, mate?
You all right, mate?
Yeah, she's back now, OK?
Yeah. Who's making all that noise?
Hey, it's just a trolley, that's all. It's only the trolley. It's OK, mate, no problem, all right?
Yeah. You all right, mate?
Oh, fall asleep.
Well, go to sleep then for a while. Hey? That's it, go to sleep, mate.
You know, every 1 year I walk past her, see the food and just smile.
Yeah, Chris.
Hello.
Should we come?
Well, your chest X-ray looks just beautiful, yeah. So there's absolutely nothing to worry about with that at all. If you get this pain back, yeah, just take what you've done today, which is just ibuprofen and paracetamol. Smoke a bit less, and everybody's happy. But this is just all insurance.
So I have to smoke less.
Yeah, always.
Stop smoking.
Give it a go. Give it a go.
Chris, you know what he looks like? Superman.
I think they like you. Thank you very much. Yeah, sorry, what's your name?
Matt.
Matt, thank you very much. Yeah.
All right, later, mate.
See you later.
Which way are we going? The food's that way.
See you later, yeah? All right, in a bit, fam. Cool.
Majors. Hello, Sarah, it's Jim. I've got a patient to refer. She has an 11mm subdural collection with no midline shift. I've spoken to the neurosurgeons.
Give me your bottle, Bill.
Once you lay back, go back to sleep. You're knackered. That's it, go to sleep, mate. All right? Just shut your eyes.
Do you want to see her here up on the ward? OK. Thank you so much, Sarah. Cheers now, bye. She has a bleed.
Really?
Yeah. Can I just have a quick chat with you next door? Is that all right? Right. Since Pat's come in, I think we've seen that she's got kind of more and more confused. And I think what was worrying is the fact that this confusion has been getting kind of worse over the period that she's been in the department. Yeah. So that's why we did the scan of her head. Now, looking at the scan of the head, there is evidence that there's some bleeding going on inside the brain.
Oh, golly.
Now, she doesn't need an operation, but she may need one in the future. It's difficult to say.
Right, thanks for coming out with it. Thank you, help me. Oh, dear. I'm not saying I've had this trouble with her before, like, you know, but that was a really bad one, like, you know.
I think I don't want to give you kind of any
No.
reassurances, but I don't
you know,
think this is as severe as that,
well,
to be honest.
I think I've done the right thing bringing her up here, didn't I?
Yeah,
Otherwise, I could have left it and, you know.
Yeah.
Anyway, thanks for your help, anyway.
There's no doubt you've done the right thing. Yeah. Have you got any questions for me at all?
Just look after. Thanks, please.
We'll do our absolute best.
I've been here for too long, 54 years. Anyway, thank you very much.
Not a problem.
Got me bottle round there.
You what, mate?
Me bottle, Bill.
Pat, hello. We are still going to have to admit you to the hospital and keep an eye on you. Is that all right? OK. Listen, if there's anything I can do, just give me a shout, yeah? OK. Take care.
Oh, thank you, Doctor.
Cheers, Bill. Thanks.
Right. Good job I did bring you up here enough, isn't it?
Yeah.
Hello there, mate.
You're all right, mate, yeah.
I want me to put back this.
All right, Pat's all going to make a move now, Gil. All right. See you later then, my love. See you later.
Right.
Thank you.
OK.
I was told it's very lucky men, really, when you fall on your head, like, you know. But then as last my mate said, it shouldn't have done you any damage. Haven't had a drink since. It's done me a favour, really. And it's, the missus is a lot happier as well.
And you stopped smoking?
Yes, lots of positive things have come out of this experience, and that is one of them, which is really, really good for me. I'm really pleased, and everybody else is pleased as well. And so is my pocket.
you.